is his own future at the helm of the Conservative Party. He is seeking to please the members of his party rather than to support the healthcare workers. Furthermore, he was against supporting people who are doing the right thing, which would protect workers' jobs with our salary supplements.
Once again, more focused on his own job and appeasing members of his own party than supporting Canada's healthcare workers. On top of that, he opposed supports for people who are doing the right thing, like keeping their workers connected to their jobs through the federal wage subsidy. Our priority has been and will always continue to be working collaboratively to keep Canadians safe.
With that, I thank you very much, and I would like to give the floor to my colleague, Jean-Yves Duclos. Thank you very much, Dominique, and hello to everyone who's tuning in. Thank you for being here today. Dr. Tam and Dr. New are joining us also virtually.
We want to talk today about how the Government of Canada is working with the provinces and territories to ensure that Canada has the tools it needs to cut the spread of the Omicron variant. On Wednesday, the Prime Minister and I announced that the Government of Canada will deliver an additional 140 million rapid antigen tests to provinces and territories this month.
On Wednesday, the Prime Minister and I announced that the Government of Canada would deliver an additional 140 million rapid antigen tests to provinces and territories this month. These tests will be delivered to provinces and territories on a per capita basis and are already beginning to be delivered.
Will be delivered to provinces and territories on a per capita basis or already beginning to be delivered. Rapid antigen tests are an important tool to empower individual Canadians to cut the spread of the Omicron variant. These tests enable Canadians to validate their symptoms and take personal action to isolate and reduce the risk to others. Rapid tests remain a first vital line of defense in helping to identify and therefore to reduce the spread throughout the country.
Rapid antigen tests are an important tool to empower individual Canadians to curb the spread of the Omicron variant. These tests enable Canadians to validate their symptoms and take personal action to isolate and reduce the risk for others. Rapid tests remain a vital first line of defense in helping to identify new spread and reduce spread throughout the country.
Yesterday, I met with my colleagues from provinces and territories, health ministers, to discuss what collectively we are doing to shore up our defenses against Omicron. I want to thank all of my colleagues from all provinces and territories for our conversations yesterday, and more importantly, for our and their continuing hard work and difficult decisions during this crisis, and for their unwavering commitment to the health of all Canadians. Together, we will continue to protect Canadians and manage through the challenges of this new Omicron variant. For the federal government, that includes securing access to leading-edge drugs and treatments, including antiviral treatments. As you know, we have already signed and secured agreements with both Merck and Pfizer to supply Canada with oral antiviral drugs. I will have more to say about those drugs and about Health Canada's approval process in the coming weeks.
Yesterday, I met my provincial and territorial colleagues to discuss what we can do collectively to shore up our defenses against Omicron. I want to thank the provincial ministers of health and territorial ministers of health for our conversation yesterday. And more importantly, I'd like to thank them for their hard work during this crisis in order to, together, protect the health of Canadians throughout the country. Together, we will continue exploring ways in which we can protect Canadians and face the challenges presented by Omicron. For the federal government, that includes securing access to leading-edge drugs and treatments, including what are called antiviral treatments. As you know, we have already signed agreements with Merck and Pfizer, and this happened in December. These companies will supply Canada with oral antiviral drugs. I will have more to say about Health Canada's assessment of these treatments and how they will be used to protect Canadians.
More broadly, getting vaccinated, wearing a mask, and taking personal health precautions continue to be the best way to stop the spread of COVID-19 in our communities. Every Canadian, every one of us, has a role to play, and the vast majority of us have stepped up to do our part. To date, 77% of all Canadians of all ages have been fully vaccinated. Right now, provinces and territories are rapidly rolling out booster campaigns, and more than 8.6 million booster shots have already been administered across the country. I'm also pleased to report that there will be enough doses of the vaccine to give all kids aged 5 to 11 2 doses by the end of this month. If you haven't already done so, I encourage you to roll up your sleeves and get that first, second, or third shot. As the Prime Minister said just Wednesday, it is never too late to do the right thing. I personally got my booster shot just yesterday, and I'm happy to say it was Moderna. Indeed, both Moderna and Pfizer are solid, efficient and safe mRNA vaccines. Je me permets de le répéter.
I allow myself to repeat it. Please, take the first vaccine that's available.
Vaccine accessible to you. Nous avons à la fois les outils et la volonté.
We have both the tools and the will to navigate this pandemic safely. But we need you. We need all of you and all of us. Getting vaccinating, wearing a mask, and taking personal health precautions continue to be the best ways to stop the spread of COVID-19 in our communities. Each and every one of us has a role to play, and the vast majority of us has already done their part. To date, indeed, 77% of eligible Canadians of all ages have been fully vaccinated. Right now, provinces and territories are accelerating their booster campaigns, and more than 8.6 million booster shots have already been administered across the country. I'm also pleased to report that there will be enough doses of the pediatric vaccine, so for children 5 to 7, to vaccinate each child with 2 doses. If you haven't already done so, I encourage you to roll up your own sleeve to get your first, second, or third shot. As the Prime Minister said earlier this week, it is never too late to do the right thing.
This is obviously a difficult and uncertain time. What we choose to do now will determine our very short-term future. The Government of Canada will be there and is there to support you in your communities and you, colleagues in provinces and territories, as we work together to finish this fight against COVID-19.
We all have a role to play as citizens to beat this virus, and we all must do our part. Let's continue to be prudent, continue to take care of one another.
We need to do, and we have the tools to do it, so let's continue to exercise prudence and caution and take care of each other.
I will now give the floor to Dr. Tam.
Merci, Minister Duclos.
Thank you, Minister Duclos, and hello to everyone.
Since the last epidemiology update prior to the holidays, COVID-19 cases have continued to accelerate rapidly, with Omicron now predominating and widespread across much of the country. Nationally, the average daily case count has increased by 65% compared to the previous week, with an average of close to 42,000 cases being reported daily over the last 7 days up to January the 5th. Although very high infection rates have challenged testing capacities in many areas of the country, which will underestimate true case numbers, we continue to test and sequence at very high levels to track the spread of the virus as well as monitor variant predominance. At the same time, we're using multiple other indicators such as laboratory test positivity and hospitalization trends that continue to be very useful for monitoring overall disease activity and severity, respectively. Currently, these trends are all increasing as a result of the sheer number of cases occurring with this rapidly spreading variant. For the most recent 7-day period, laboratory testing positivity is estimated at 29%, indicating significant community transmission. Although evidence from ongoing surveillance and recent studies indicates that this risk of hospitalization is lower for Omicron compared to Delta, the sudden acceleration of Omicron and enormous volume of cases is driving severe illness trends. Given current daily case counts are already about 400% higher than the peak of the third wave, it is not unexpected to see daily hospitalizations rising. However, international surveillance suggests that while these trends can be expected to increase with the Omicron surge, severe illnesses are not rising at the same explosive rate as for cases. Presently in Canada, over the past week, an average of close to 3,650 people with COVID-19 were being treated in their hospitals each day, with almost 600 in intensive care units, representing weekly increases of 91% and 25% respectively. During the same period, there were on average 39 deaths reported each day. Currently, we still need millions more Canadians to increase their protection with COVID-19 vaccines, including almost 7 million eligible people who need a first or second dose of their primary series. As well, many others are eligible to get a booster dose to help restore protection that may have waned since their second dose. Moreover, there is accumulating evidence that a booster dose results in better protection against severe illness, including against the Omicron variant that appears to have a higher degree of immune evasion. Booster doses are particularly important for certain groups, such as healthcare workers and those at highest risk of severe illness from COVID-19, including older adults, people with high-risk medical conditions, and people in and from Indigenous communities. Either Pfizer-BioNTech or Moderna mRNA vaccines are effective as boosters, so please feel confident in accepting whichever vaccine is offered to you. As public health authorities continue with vaccination efforts, while closely monitoring local epidemiology for signs of peaking activity in the weeks to come, we can all help by reducing our contacts to get us through this difficult time that much faster. Practically speaking, we need to continue to get fully vaccinated and receive a booster dose when eligible, limit in-person contacts to immediate household members as much as possible, and consistently use layers of personal protection to reduce the risk of exposure and spreading the virus, including wearing a good quality and snug-fitting face mask, maintaining good ventilation, and following local public health advice. This might feel like a double marathon that we didn't sign up for, but despite feeling tired, we should have a sense of achievement for the ground we've covered so far, for staying on track and knowing we can still draw strength from each other to get where we need to go. Thank you. Merci. Megwich.
Thank you, Doctor.
Bonjour à toutes et à tous.
Hello, everyone. Since the last epidemiology update prior to the holidays, COVID cases have continued to accelerate rapidly, with Omicron now predominant and widespread across much of the country. Nationally, the average daily case count has increased by 65% compared to the previous week, with an average of close to 42,000 cases being reported daily over the latest 7 days up to January 5th. Although very high infection rates have challenged testing capacity in many areas of the country, which will underestimate the true case numbers, we continue to test and sequence at a very high level to track the spread of the virus, as well as monitor variant predominance. At the same time, we are using multiple other indicators, such as lab test positivity and hospitalization trends. They continue to be useful for monitoring overall disease activity and severity, respectively. Currently, these trends are all increasing as a result of the sheer number of cases occurring with the rapidly spreading variant. For the most recent 7-day period, lab test positivity is estimated at 29%, indicating significant community transmission. Although evidence from ongoing surveillance and recent studies indicate that the risk of hospitalization is lower for Omicron compared to Delta, the sudden acceleration of Omicron and enormous volume of cases is driving severe illness trends. Given current daily case counts are already about 400% higher than the peak of the third wave, it is not unexpected to see daily hospitalizations rising. However, international surveillance suggests that while these trends can be expected to increase with the Omicron surge, severe illnesses are not rising at the same explosive rate as cases. Presently in Canada, over the last week, an average of close to 3,600 people with COVID-19 were being treated in our hospital each day, with almost 600 people in. This represents a weekly increase of 91%. During the same period, there were on average 39 deaths reported each day. Currently, we still need millions of Canadians to increase their protection with COVID-19 vaccines, including the almost 7 million eligible people who need a first or second dose of their primary series. As well, many other eligible people are eligible to get a booster dose to help restore protection that may have waned since their second dose. Moreover, there is accumulating evidence that a booster dose results in better protection against severe illness, including against the Omicron variant that appears to have a higher degree of immune evasion. Booster doses of the Pfizer and Moderna mRNA vaccines are particularly important for certain groups, such as healthcare workers and those at highest risk of severe illness from COVID-19. This includes older adults, people with high-risk medical conditions, and people in and from Indigenous communities. mRNA vaccines, whether Pfizer or Moderna, are effective booster doses, so trust them and accept the vaccine that is offered to you. As public health authorities continue with vaccination efforts, while closely monitoring local epidemiology for signs of peaking activity in the weeks to come, we can all help by reducing our contacts to get us through this difficult time that much faster. Practically speaking, we need to continue to get fully vaccinated and receive booster doses when eligible. Limit in-person contacts to immediate household members as much as possible. Consistently use layers of personal protection to reduce the risk of exposure and spreading the virus. This includes wearing a good quality and snug-fitting face mask while maintaining good ventilation and following local public health advice. This may feel like a double marathon that we didn't sign up for, But despite feeling tired, we should have a sense of achievement for the ground we've covered so far, for staying on track, and knowing that we can still draw strength from each other to get where we need to go. Thank you. Merci, Miigwech.
Thank you, Dr. New. We have 36 minutes for questions and answers. We'll be going to the phones for the first section, and with one question, one follow-up. The final 10 minutes will be for the reporters in the room. Operator, would you please begin, please? And a reminder, if the questioners and the people answering could keep everything succinct so we can get through more people. Please go ahead, Operator.
Thank you, merci. You may press star 1 if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. La première question est de Boris Proulx, Le Devoir.
Boris Proulx, Le Devoir.
Bonjour. Au sujet des tests rapides.
About rapid testing. In Quebec, deliveries of new tests in January considered a good news, but there's no prediction for February, March, and following. Do you know if deliveries will be the same amount or higher in the months after? Answer. Thank you, Mr. Proulx and Mr. Boris, for the question. One, we understand that the provinces have this wish of having a better predictability with materials. We also wish this. Our suppliers are facing worldwide supply chain challenges. So we're trying to bring as many tests as possible, as quickly as possible. I understand that my colleagues throughout the country are looking for more predictability. I've spoken with my staff, and I'm working with the Minister of Procurement to see what we can do on that front. We need short-term predictability and also long-term predictability. Yesterday, we started a discussion that will continue in the next days and weeks regarding the distribution strategy for rapid tests. We have three main objectives. The first is, of course, to use these tests to meet our obvious public health objectives. The second is to be efficient. We want these deliveries to be quick and predictable, and that they serve public health objectives that are, of course, connected to our economic targets, to maintain our economy. And the third objective is to be equitable. We want to make sure that these tests are delivered to those people who need them the most, knowing that we'll also always have a scarcity of these tests in short and medium term. I'd also say that I have more specific numbers. We're getting 31.5 million tests in Quebec for January out of the 140 millions. In Ontario, it's 54 million. Alberta, 16.2 million tests, and the other provinces will receive tests according to their population. Question. In the introduction, you said that rapid tests were essential. Before the holidays, Minister Freeland said that we had enough for everyone. So do you have an answer to explain why people in your own riding aren't able to get their hands on a rapid test? Answer. Well, before December, we respectfully found that there was very little demand for rapid tests throughout the country. This isn't pointing the finger at anybody, it's just a statement of fact. Things changed in early December with the arrival of the holidays. We knew that people were going to see more people, so provinces and territories advised us that there was a higher demand for rapid tests. In December, we received 5 times more requests for rapid tests that we'd had in the previous months. So we were able to deliver many more tests than the months prior. But with the Omicron variant, we found that even with this increased demand from the provinces, stocks were insufficient to respond to demand. So in January, January, we will deliver 140 million tests, which is 4 times more than what was delivered in December, which was 5 times more than what was delivered in the months prior. We're working very quickly, especially considering that worldwide supply chains are very fragile with rapid tests. We work daily with our suppliers to make sure that we have the amounts of tests delivered per the deadline.
Operator, next question,
Thank
please.
you. Thank you. Merci. The next question is from Ryan Tumulty from the National Post. Please go ahead.
Yeah, hi. My first question is for Minister Duclos. Dr. Tam, before the Christmas break, released her annual report calling it a vision to transform Canada's public health system. It calls for a lot of changes, more data, more workers, that sort of thing. I'm wondering if you support this vision, if your government's going to be acting on it.
Yes, 3 important items, as you mentioned: data, workers, human resources, and technology. We had a conversation on that with my colleagues, health ministers, yesterday. These are going to be key, not only in going through the current Omicron crisis, but also in terms of emerging from that crisis and rebuilding our healthcare system. We need a lot more data for all sorts of reasons. We need more workers. Health workers are tired, exhausted. They have left in large numbers. In the current circumstance, they are sick in very large numbers as well. And we need to be making better use of technology, some of which we have developed in the COVID-19 crisis, but some of it we have to develop as quickly as possible, as I said, both to exit and to rebuild from the crisis.
Supplementary, Ryan?
Yeah, this one's from Minister LeBlanc. You mentioned off the top of the presser that the federal government's resources are limited, that health is a provincial jurisdiction. Are you telegraphing, I guess, to provinces that in terms of their requests for emergency help, like you received from the Bearskin Lake First Nation today, and I'm sure you'll receive from other provinces as the week goes on, that there is a limit to what the federal government can provide, and that maybe you are hitting that limit?
I think what we've said 2 things from the beginning of the pandemic, that obviously the government of Canada will do whatever we can, as often as we can, to support provinces and territories and Indigenous communities. So that shouldn't surprise anyone. And I think over the last 22 months, we have worked very collaboratively with provinces and territories and Indigenous leadership to certainly, in an unprecedented way, use the resources of the government of Canada, wherever and however we could bring them to bear, in a way to support provinces and territories. We expect, as you noted, an increase in the coming weeks in terms of requests for assistance. My colleague Jean-Yves Duclos, Patty Haidu, Bill Blair, obviously, we're in ongoing and active conversations with provincial counterparts, and they're saying to us that we're preparing perhaps a request for assistance in this particular area, or we're wondering if the government of Canada might support a provincial or Indigenous community in another area. So we're moving expeditiously to do obviously everything we can. But it's no surprise that provincial and territorial governments have considerably more health human resources, for example, than would the government of Canada. And that's why we need to be expeditious and effective in allocating all the federal resources we can in a way that most efficiently fills the gaps that provinces and territories identify. So it's an ongoing, collaborative, and we think positive exercise. But it shouldn't surprise anybody that it's not a limitless number of federal health care resources that we can bring to bear. So our job is to take absolutely everything we can and allocate it in the most effective way to support all of our partners and Canadians to come through the other side, particularly of this urgency around the Omicron variant.
Operator, next question, please.
The next question is from Christy Kirkup from the Globe and Mail. Please go ahead.
Hello. Provinces are imposing restrictions or lockdown measures due to healthcare capacity. And of course, we've seen this a lot in Canada. And I'm wondering if this shows that from coast to coast, the capacity of Canada's primary healthcare system is stretched too thin. And how is the federal government going to address this?
Well, thank you. And I agree with your statement. The capacity is stretched too thin, certainly in the current emergency context. But more broadly, I think most Canadians would agree that even before COVID-19, our capacity was often stretched too thin, in particular around this time of the year when there were other respiratory diseases and other challenges around the particular season. Now, what we're doing, well, what we've done during with COVID-19 was to invest just in terms of healthcare, a total of $63 billion, in addition to all of the other transfers that were already in existence before COVID-19. We obviously provided a lot of support, economic support. More than 80% of the total direct assistance to workers and businesses came from the federal government. And what we have announced in the campaign was an additional $25 billion to be invested in the relatively short term to address all sorts of issues around health and healthcare, but in particular, the healthcare resources issue, which is a tremendous problem across all the country. If I may add briefly to what Minister Leblanc said a moment ago, we often think of the Canadian Armed Forces as being a potential source of important healthcare support. They have a population of about 70,000 personnel to serve. Now, 70,000 is about 8 times less than my own city of Quebec. Quebec City has 8 times more people than that 70,000 personnel that healthcare workers in the armed forces need to be looked after. So that says that we have a very limited amount of healthcare resources, health-trained people in the CAF, and that's why we have to answer in the most appropriate, the most focused, and the most equitable manner when requests are made by provinces for healthcare personnel support. What we can do, and what Minister Leblanc also mentioned, is to provide vaccines, tests, personal protective equipment. We can provide tracing support. We can provide all sorts of other non-human resources types of assistance. This we have done, I think, quite successfully, and will continue to do in the short and the longer term, as we do our best with the Canadian Red Cross and other partners to also provide, in some specific context, support on health-related human resources.
Supplementary, Christy?
Yes, thank you. And just as a follow-up, if I may, the other day when you announced the 140 million rapid tests that will be going out to the provinces and territories on a per capita basis, I'm wondering, I fully understand that you have said that the distribution falls into the realm of the provincial and territorial governments. But I'm wondering, do you have any concerns about the equity of access? We've seen, for example, in the province of Ontario, people lining up in minus 20 degrees Celsius for hours on end trying to get access to rapid tests. And I'm just wondering, do you have any concerns about this? And frankly, not a lot of Canadians have the time to line up in frigid, cold temperatures to try and get access to a test that can maybe tell them if they have COVID-19.
Thank you. Well, on the equity and the efficiency of the distribution, we have full confidence that provinces and territories will do what they need to do to address the needs of their population. The Prime Minister on Wednesday mentioned that again. They have access to more information and to more networks to distribute those tests in the most fair and efficient manner. One equity issue which I would add, which you didn't mention in your question, was the equity of the distribution of rapid tests across provinces and territories. The reason we're moving to a per capita formula is that prior to January, there were provinces and territories that didn't ask as many rapid tests as they could have asked based on their per capita share of the population. So with a per capita formula, we're going to make sure that every province and every territory, and therefore every person in Canada, wherever that person may live, has access to the same amount of rapid tests, and that again is going to be done by the per capita formula.
Thank you, operator. Next question, please.
La prochaine question de Mylène Crête, La Presse.
Mylène Crête from La Presse.
Bonjour, j'ai une question concernant
Hello.
Le réactif qui est utilisé.
I have a question using the reactive agents used for PCR testing. Do you anticipate a shortage of this agent? Answer: we know that the reactive agent is in high demand, and I'll ask Dr. New to respond further in a few moments, but currently there is no indication from the provinces and territories that there is a shortage. So a request for reactives from the government, federal government, should there be a demand, the federal government will react as quickly as possible and as effectively as possible. But in order to have up-to-date information, I would like Dr. New to respond. Thank you for the question. I can tell you that the National Microbiology Laboratory in Winnipeg has worked closely with its colleagues at the provinces and territories. This is an open discussion. We are aware of the situation that exists in provinces and territories. Just like before, the National Laboratory is ready to support as needed. If there is a challenge, the lab can support provinces and territories as needed. Question: regarding requests for assistance, how many provinces and territories have made such a request or have indicated that they will make a request to the federal government? Answer: I would like to invite Minister Leblanc to answer more generally, and then I will give more specific information. Answer: thank you, Jean-Yves. I think the Prime Minister and Minister Blair have said for a long time that there are over 144 or 155 formal requests for assistance between the provinces and territories and the federal government since the start of the pandemic. Of course, there are many different circumstances. Some of them are not related to the health crisis. Some are related to increased requests for support. This is a good process between the federal government and the provinces and territories and the National Operations Center. There's ongoing collaboration between governments regarding need for assistance. We want to avoid surprises, if you will, and be able to respond, like Jean-Yves Duclos said. We would like to respond as effectively and quickly as possible. So just by stating the circumstances of Omicron throughout Canada, we know that provinces and territories will request aid from the federal government. Our answer is always yes, in as much as it's possible. What's important for us and what works well for us is to have these ongoing conversations that allow us to be ready and to identify the best way to support a provincial authority when they make such a request. Answer: and for Quebec more specifically, if I could add something. This is about vaccination, of course. Very generally speaking, I would like to say that provinces and territories have increased their vaccine administration in the last few weeks. In December, we were vaccinating about 1 million people per week. throughout the country. In early January, vaccination rates were about 2 million per week, and now we're looking at 3 million vaccinations per week compared. So the rates are not as high as they were this summer, but we are picking up the pace on vaccination. I think that all Canadians and all Quebecers are very proud of the work that's being done by provinces and territories. The 200 armed forces personnel that are being deployed to Quebec are there to accelerate vaccination efforts for booster shots. This is excellent news. I think they are working in 5 different places: Montreal, Laval, in the Centre des Congrès, the Olympic Stadiums at de Carey Square, in Laval at Sport Expert Place, and also in Ahuntsic on Montreal. So 5 different places in Montreal are welcoming armed forces to help us with vaccination efforts. 100 other people are on hand that can be added to this effort if needed. And one more thing that I'd like to say, because I was shocked when I heard it, when I heard Mr. O'Toole said, which was alluded to by my colleague, Mr. Leblanc, Mr. O'Toole was criticizing Canadian leadership and provincial leadership. There's a minimum level of leadership that we are expecting from Mr. O'Toole, and that is to get all of his members vaccinated. Vaccination is the one thing that will get us out of this crisis and that will help us fight against the Omicron variant. We all have a part to pay, and federal elected officials have a role to play, and they also need to lead by example for all Canadians.
La prochaine question est de Olivier Ferron-Boissé, TVA Nouvelle. La parole est à vous.
Next question from TVA Nouvelle. Yes, thank you for answering our questions. More than half of hospitalizations in Quebec are for people who are not vaccinated. There are people that are age 50 and up that are refusing vaccination. Are we going to be adding other measures federally? Answer: this is very relevant. This is a question that will come up from the federal government, from the Quebec government. I know that the situation is very difficult there. I know it's also difficult in other provinces. But if I can make a quick aside, in the Omicron wave, Quebec is first, second comes Ontario, but also other provinces will experience very difficult situations with regards to hospital capacities. And they will be challenged in their ability to provide intensive care services. Dr. Tam was alluding to this earlier. There are almost 6,000 people that are hospitalized, many of them in Quebec. This is the perfect storm that we were talking about at the very start of December, the perfect storm of reduced healthcare workers combined with a considerable increase of people who need hospital care. The number of people infected by Omicron has increased significantly. So the situation is very difficult. I have complete confidence in each province and Quebec in particular to do what needs to be done. We have to emphasize vaccination. This is true for Mr. O'Toole and anyone else who still has doubts about the importance of having everyone vaccinated. Vaccination is what's going to get us out of this challenge, not only in the short term, but in the long term. COVID-19 will continue to be among us. There will be more variants. Omicron will continue to be among us for a long time. The only way to get out of this and to get a normal life is to get vaccinated. We need a mass amount of people to get vaccinated. We need our children vaccinated. We need people to get booster doses. We need to protect ourselves and to protect our loved ones. Question. My question is mostly about compulsory vaccination, like they're doing in Italy, where people will be hit in the pocketbook if they don't get vaccinated. Answer. I will give you a personal point of view. It's personal and not necessarily relevant because this is a decision that will be made by the provinces. I personally think we will get there at some point. Mandatory vaccination. There will always be exceptions, of course. People who have medical reasons to be exempt will be allowed not to get vaccinated. But what we're seeing now, what we felt would come a few weeks ago, what we're seeing throughout the world, we know that COVID-19 will be with us for many more months to come, maybe even many years. Given how fragile our healthcare system is in Canada, our aging population, increasing costs associated with taking care with everyone, I think this type of measure, which is not being considered now, and we understand why, but it will be part of what people think about in provinces and what they think they could put into their action plans.
For people on the phones, reporters in the room, we're going to try and land this in 11 minutes. So we'll begin with Creason from CTV, please.
Minister Duclos, thank you for taking my question. Can you provide any more details on the help needed for Bearskin Lake First Nation? At least half of the community of 400 have COVID. The chief there is calling for military aid now for 14 days or longer if needed. Ontario has joined in on those calls for military aid. Is the federal government going to answer those calls, and can you provide any timeline on this?
Well, three things here. First, we, and when I say we, it includes my colleagues, Minister Aidu and Minister Miller, Minister Blair, Minister Mendicino. So all my colleagues are very mindful of the very difficult challenges that those communities are facing now. The second thing is that we have had some relative success, and I think most people will say that we have had significant success working with Indigenous communities over COVID-19 in delivering to them the types of support that they need to look after the members of their community. And the third thing is that Minister Aidu in particular is in contact every day with leaders of those communities so that they can be provided with the type of support that they need. And from my part, with the Public Health Agency of Canada, we are also working with Minister Aidu and her team and her department to make sure that they have all the resources, the vaccines, the tests, the PPE, the tracing support, the expert advice that Minister Aidu and her department need to look after Indigenous communities and to help them go through this renewed challenge.
Is that a no on military aid so far? No decision made on that?
I would direct you towards Minister Blair and Minister Aidu for more specific information on that.
Also, Minister Duclos.
We've got to go to Christian Noel to get through 4 people, please. So, Christian, please.
Hello, Mr. Duclos. Christian Noel from Radio-Canada. Regarding mandatory vaccination, when is the point that we have to start thinking about it? You said that soon it will be something we'll consider. When will that moment come? Answer. I really can't speak to that. What I said earlier, and I would like to repeat it, is it's a personal opinion. When I speak to experts in the country and internationally, public health experts tell us what we're heading towards. If we want to bring Canada, our Canadians, back to a more normal life, when we see how much strain is on our healthcare system, we understand that we have to get out of this situation. The one way to get out of it is to get vaccinated. Rapid testing, masks, distancing, PCR tests, all of those are great measures. They are part of our toolkit, and they are important. But the way to get out of this crisis definitively is to get vaccinated. That's why I see it coming personally. Not now. I don't think we're there yet. But I think that discussions need to be had about mandatory vaccination because we need to get rid of COVID-19. You said earlier about rapid testing that we're doing better than other countries. But we still have supply issues. Specifically, what are the logistical challenges that we're facing? And how are these preventing you from telling us how many tests we'll have in February and March? Answer, we're of course very focused on the present. Currently, quickly, how can we get the maximum number of tests in our provinces and territories? That's what we're focusing on now. At the same time, we have to start having discussions about a longer-term strategy. Of course, this will be according to provinces and territories' needs and desires.
About disparities in provincial distribution of rapid tests. Saskatchewan has gotten more than twice as many tests as Manitoba because they had asked for more. You're now shifting the demand to per capita. Minister Van Dell says, to be fair, you should balance this out to make up for provinces that got less. So I'm wondering if you're going to revise the per capita formula or if Manitoba is going to stay shortchanged here.
Well, the revision is started to be in place on January the 1st. As of January the 1st, our allocation formula is now a per capita formula, so that we can make sure, as you've correctly and appropriately mentioned, that all provinces and territories, and therefore everyone in Canada, has access to the same number of tests, and that there are no equity issues in terms of interprovincial considerations.
Okay, so you're not going to make up for that then?
Well, we'll always be in conversations with provinces and territories, but as I said, we're focusing on the current needs, and the current needs will be addressed on a per capita allocation formula.
Laura Osmond, CP.
Thanks, Ministers. I wanted to pick up on where my colleagues Ryan and Christy left off on the sort of finite resources of the federal government. We've never seen all provinces be so stressed at the same time. We know these requests are coming. We know our resources are finite. So what is the plan when we simply run out of resources? Is it up to provinces to sort of model it out at that point? Or what can you do in the meantime to try to fill that gap?
You're right. The two things on that. First, you're correct. The stress is seen everywhere. Second, this being said, the stress is being seen a bit earlier in some provinces than others. And there are two consequences for that. The first one is that Ontario and Quebec in particular, that's where the greater stress is currently found. Those provinces and those two provinces are going through a very difficult time. That, however, is a signal to other provinces and territories that they may be just a week, perhaps 2 weeks behind, but they see, and I've observed that just yesterday with my colleagues from other provinces, they see what's coming. So they know that public health measures that everyone understands now will need to be applied across Canada because it's the same variant across Canada. So although a province may be just a week or two behind another province in terms of a stress on healthcare resources, that's coming, and sometimes coming very quickly. So I'm thinking of provinces where the number of hospitalizations per capita might be slightly smaller now, but these provinces and territories must know and must act on the basis of what they see with other provinces like Quebec and Ontario.
But Minister, eventually the federal government's going to have all of the personnel out that they're able to offer, and the provinces are still going to be short. So what happens then? What is the plan?
Well, as Minister Leblanc said a moment ago, we'll continue to support provinces and territories to all possible extent. We've been quite successful at doing this collaboratively over the last 22 months, and we'll continue to do that, knowing that there are some types of support that the federal government will find harder to provide because we don't have the capacity. And that's also a warning, a kind warning, but a clear warning to some provinces and territories that they need to act now, because if they don't act sufficiently, it's going to be difficult for the federal government to help after because we don't have the capacity to do so.
Sorry, act how?
Sorry?
In what way should they act?
Well, everyone is doing their job, and I'm saying that again, based on my conversations with them yesterday. They are acting, and they are right to act. And public health measures are obviously key, providing support to businesses and workers so that lockdowns can be applied while taking care of the ability for everyone to pay for food. So these types of things are important. Lockdowns in some contexts when we see that the pressure is going to be too strong for in particular, our healthcare workers.
Minister, I think we have just enough time for Creason's other question, and I'm being asked for you to repeat in English your view about mandatory vaccines at some point. I believe you may have said that in French, and I just ask you to ponder that for a second and take Creason's final question.
Yeah, well, I can do that, and I'll say two things. First, it's a view which is based on my personal understanding of what we see internationally and domestically, and in my conversations with my colleagues, health ministers, over the last few weeks. And second, it's a decision that will be made by provinces and territories at some point, whether they move forward or not, that's going to be their decision to make. But what we see now is that our healthcare system in Canada is fragile. Our people are tired. And the only way that we know to go through COVID-19, this variant and any future variant, is through vaccination. PPE, physical distancing, tests, rapid tests, PCR tests, these are all very important tools. But what will make us move through this crisis and end it is vaccination. And I see in my own province, 50% of hospitalizations now in Quebec are due to people not having been vaccinated. That's a burden on healthcare workers, a burden on society, which is very difficult to bear, and for many people difficult to understand. So that's why I'm signaling this as a conversation which I believe provinces and territories, in support with the federal government, will want to have over the next weeks and months.
Really appreciate that, and we'll end with Creason's final question there.
Minister Duclos, Erin O'Toole said the unvaccinated should be accommodated through measures like rapid testing. What do you think should happen in this regard?
Can you? I was just slightly distracted.
Yeah, no, that's okay. Erin O'Toole said the unvaccinated should be accommodated through measures like rapid testing. What do you think should happen in this regard?
Rapid tests are not going to end the crisis. Rapid tests are not going to solve COVID-19. The only thing that will solve COVID-19 is vaccination. And that's why, again, so many people, including myself, are disturbed by the fact that Mr. O'Toole is not even asking his own members of parliament to be vaccinated. That's I don't understand, and I think no health expert understands, and most Canadians don't understand. No. The only way to end this crisis is to be vaccinated. Other tools are important, but Mr. O'Toole should ask his members of parliament, his caucus members, to be vaccinated. That would be a sign of leadership on his part. And before we end, je sais qu'en français, au Québec en particulier,
I know that in French and in Quebec in particular, in the last few days, we've been shocked and concerned by the story of those travelers on that Sunwing flight. Like many people said, their behavior was irresponsible and inexcusable and unacceptable. In the last few hours, we've received updates on some of these travelers. They are hoping to come back to Canada. So starting as of Wednesday, 27 of the 130 passengers have arrived back in Canada. They took 4 different flights. They were met at those 4 airports. They were intercepted and interrogated at the air border. They were all tested on arrival. Respecting public health advice was enforced. We checked their vaccination status, their PCR test results, and their quarantine plans. the Sécurité du Québec contacted Public Health Agency of Canada to obtain contact information for these travelers to make sure that they are following their quarantine plans. Also, their files have been referred to the Government of Quebec for penal and criminal issues, because this is provincial jurisdiction and they will have to follow up on these infractions. All of this is added to the investigation that will continue with regards to how they broke transport rules. There are public health rules, but there are also Transport Canada rules. If we see the images that were shared, Transport Canada rules were broken. So there you have it.
Because Sunwing has been such a cause célèbre across the country, if you could share your thoughts on that in English as well, because I think I heard some news there.
Okay, so I'll try to do that in my best English. And so first, we hear and we know that this issue of Sunwing travelers having behaved irresponsibly, inexcusably, and unacceptably on a flight to Mexico, that has raised a lot of anger and frustration, as the Prime Minister said just 2 days ago, on the part of many Canadians. Recent information that we were given indicates that about 27 out of these approximately 130 passengers have now returned to Canada on Wednesday. They were all stopped and interrogated at the air border. They were then all tested. They were checked with regards to whether they had obeyed and followed all of the health regulations that they were supposed to follow throughout their trip, in particular regarding their proof of vaccination, the quality, the integrity of their PCR test. Their quarantine plan were also inspected. And all of that was correlated with the information that they had entered into ArriveCan, which is an essential tool for all travelers entering Canada. La Sûreté du Québec, which is the provincial police department, proactively contacted the Public Health Agency of Canada to seek information on those travelers. The contravention files that were issued for some of these travelers were sent to the Government of Quebec through their legal authority and team, and that's in addition to the ongoing investigation and possible prosecution that Transport Canada and other agencies will continue to pursue.
Minister, I really appreciate your briefing today. Doctors, thank you. Thank you to Minister LeBlanc and Moncton. And this completes this news conference and briefing from the Parliamentary Precinct in downtown Ottawa.
Hello, everyone. I'm Suhanna Marchand. If you are just joining us, welcome inside the CBC newsroom. We've been carrying an update on the latest national pandemic developments for you. Health Minister Jean-Yves Duclos, we heard from him and other officials giving us details on, among other things, those hard-to-find rapid tests. Millions more coming this month. We got some